Communication, the Key to Better Patient Satisfaction Among Hispanics. A cultural presentation by Amanda Erickson and Megan Kessel. Patient satisfaction is an important outcome of healthcare experiences. Unfortunately, equal levels of satisfaction are not enjoyed by all patients in the United States healthcare system. Many studies document lower levels of satisfaction among Hispanics when compared to other racial or ethnic groups. This presentation will explore the contingent factors and considerations within this disparity, as well as opportunities for expanded growth. To understand a little better, let's explore the definition of satisfaction, or in Spanish, satisfacción. Satisfaction is an effective response associated with a cognitive appraisal of the extent to which needs, desires, and expectations for specific goods or services have been met. Hispanic and Spanish-speaking patients experience lower satisfaction with their health care when compared to whites and English speakers. In order for satisfaction to be high, there must be a degree of communication. Communicación is defined as the exchange of thoughts, messages, or information as by speech, signals, writing, or behavior. Now that we have a better understanding for what satisfaction is, let's examine why it is important. Poor patient satisfaction scores are indicative of lower unit morale. Low morale equals low performance by staff and high turnover. In 2006, 15% of the U.S. population was Hispanic, and this percentage will continue to rise. The proportion of the Hispanic population is estimated to increase by nearly 25% by the year 2050. There is a strong correlation between patient satisfaction and patient outcome. The more satisfied a patient is with their care, the more likely they are to follow instructions given by the care providers, thus increasing compliance and overall outcomes. Now, let's look at some considerations for patient satisfaction. As you will see in the video to follow, culture shock is a huge consideration for satisfaction. Just like the video, our patients often experience these same feelings of frustration. It is important to remember that not everyone has the same culture as you and that their feelings, beliefs, and daily life choices should be respected. Cultura, or culture, is defined as the inherited ideas, beliefs, values, and knowledge which constitute the shared basis of social action. Other considerations for patient satisfaction are listed on this slide and include the feelings of disrespect by providers based on how well Hispanic patients speak English, longer wait times, clinicians' age, and cultural competence of staff. Culture influences how individuals define and express illness, suffering, and dying. Lack of cross-cultural skills among healthcare providers or a failure to understand cultural values may lead to poor patient outcomes and inappropriate interactions in clinical settings. Although communication is the key to patient satisfaction, it does not come without some barriers. A barrier, or barrera, is defined as something that makes it difficult to understand each other. In the following video, notice how communication barriers can be frustrating, difficult to handle, and may cause delays in care. While you're watching the video, think about each barrier that each girl goes through. There are more than just communication barriers.
Excuse me? Hello? Hey! I'm a human being. If you don't want to help, at least say so.
Hello, I am deaf. I may have trouble comprehending you. Thank you for your consideration. Usually, I'd read your lips to understand you.
Oh,
If you like, you could let this convert your speech to text for me.
okay. Could you tell me how to get started?
Want to try again?
Attention passengers, all is well. Thank you.
Low power shutting down.
Oh, yay!
Attention passengers, line 4 is delayed for 1 hour. Thank you.
Other common barriers include patient and physician primary language, patient's education status, time, and cost of providing interpreter services. Patients using the same language as their providers generally report higher ratings of care. Having an ethnically concordant physician familiar with cultural nuances and norms may contribute to better clinical interactions. Also, spending time with patients makes them feel heard, appreciated, and important. A lack of adequate time for discussion or education can have the exact opposite effect. As for interpreter services, buying software and equipment or subscribing to services for interpretation can be very expensive. The cost associated with providing one patient interpreter service is approximately $234 per intervention. Now, looking at the statistics, we believe that satisfaction with provider listening is 6.8% higher for English-speaking patients. Bilingual patients experienced higher satisfaction than those who spoke only Spanish when communicating with their provider and receiving help from office staff. The largest gap in satisfaction, however, was found to be the amount of time providers spent with patients. Villani and Mortensen found in 2014 that Spanish-speaking individuals expected to spend longer amount of time with their providers during appointments, and this expectation could be based on customs from their native countries. So, knowing all of this, how do we improve? As demonstrated on this slide, immediate attention throughout the admission process by the nursing team and interpreter services is one area for improvement. as well as regular rounding on inpatient units with all facets of the healthcare team. It is important to provide the patient with their diagnosis and discuss plans of care as well as test results during this time so that patients feel involved with their care. We can also ensure patients have a way to contact members of their care team by providing names and numbers of those involved in patients' care. We can also utilize teach-back methods to ensure proper understanding of information and teaching. This sets the patient up for success and better satisfaction with their care. Confirming that the patient has any follow-up appointments needed, transportation to get to their appointments, a clear understanding of where their appointment will be and with whom. If the patient has been in a hospital, there is a possibility that they will need to be seen by a specialist after discharge. Unless they were a patient of the specialist before their admission, it is unlikely that they will know where the clinic is located. An easy way to ensure that they will not miss the appointment or have misunderstandings is to print them off directions to the office from their home in Spanish. You may also consult case management, as they may have more access to community resources and contacts. Most importantly, however, communicate with your patients. Ask questions like, ¿Qué puedo hacer para que su experiencia de grande? What can I do to make your experience great? You could also ask, ¿Cómo está usted? A simple how are you can be seen as friendly and inviting. Another useful phrase that can be used to seek information from a Spanish-speaking patient is to say, ¿Cómo se siente hoy? How do you feel today? On the administrative side, however, opportunities for improvement stem from process and staffing changes. One opportunity for improvement is to require cultural competency training for all staff, provide interpreter services, consult case management, increase the proportions of minorities in clinical education, increase the amount of bilingual staff, and offer staff incentives for becoming bilingual. Having a Spanish-speaking physician improves Spanish-speaking patient satisfaction with physician care and with the hospital stay overall. So now we wonder, if we do all of these things, how is it going to benefit the patient? Well, it will provide better understanding of their health through increased communication with clinicians, improved health results, increased healthcare compliance, improved decision-making, and feelings of satisfaction, which is the ultimate goal. The benefits for us will become prevalent also. As patients will be happier with their care, there will be less barriers, increasing efficiency and time management, a decrease in overall readmissions, increased job satisfaction, and will lead to decreased staff turnover. In conclusion, health literacy is defined as a constellation of skills including reading and numerical comprehension that allows patients to function in their healthcare environment. Research continues to show that health literacy has an effect on patients' disease-specific knowledge, overall health status, and how to make use of various healthcare services. The study by O'Brien and Shea in 2011 found a significant correlation between health literacy and patient satisfaction across all domains. Becoming an active and engaged listener can decrease instances of miscommunication. Be aware of cultural competency by taking a class or doing independent research on cultures different from your own. In addition, just because something is unfamiliar, you should not avoid it. Avoiding a patient or neglecting education because of language barrier is inappropriate, disrespectful, and rude. And finally, take a multidisciplinary approach to care. Include your patient. Communication is the key. The more the patient understands, the more they will view their care as satisfactory.